Oh, that's okay. That's okay.
It's very nice to meet you as well.
Good evening.
I'll probably move around a little bit. I'm a bit of a pacer.
Hello. We're just going to get started. So I really want to thank everyone for coming out on such a nasty day to join us for our program this evening. Our program tonight is Unlocking Mental Health. Discover the who, what, where, when, and how. Our speaker tonight is, and I have to give her a lot of credit. She traveled 2.5 hours to get here for a typical hour and 45-minute trip. So welcome to Pennsylvania. So Brittany Ketchum is a licensed social worker who got her undergraduate degree and her graduate degree at Marywood University. Yay, my alma mater too. So she is going to address some questions that we received ahead of time, but then we'll also allow everybody here to ask whatever questions pop up in your thoughts after you hear her speak. Wanted to just briefly let everyone know that you are welcome to join us for our next Third Wednesday series, which is actually a two-part series. The first one is June 18th. The second one is July 16th. And those will deal with estate planning for all ages. So you may think you're young, but it's never too early to start. So thank you so much. And Brittany, welcome.
Thank you, Anne, for that lovely introduction. I really appreciate it. So I'm just supposed to hit the forward here.
Give us 1 minute.
Okay, yep, sure.
There you go.
Great, thank you. So who am I and why did they ask me to speak here tonight? It's probably because they could not find anyone else, not gonna lie. So I decided to step in and of course, you know, brave that Pennsylvania traffic on 80 and 81, which can always be quite a nightmare. But I am currently the Regional Manager of Behavioral Health for Geisinger Health Plan. I am also a therapist with Mind and Thrive Wellness. And right now I'm a licensed social worker and I'm working towards my licensed clinical social worker. I have all my hours ready. I'm just waiting to sit for my actual examination. So getting ready to do that. And as Anne mentioned, I did graduate right in Scranton's backyard here with my MSW and my MHA. I'm a dog mom. I love sports. I'm a mental health advocate. And I'm a psychological thriller aficionado. So along with any mental health questions that you may have, please come to me with all recommendations for any amazing psychological thrillers you may have read. I will appreciate that very much. So first we're gonna get into the what. And I do have my handy hard copy notes here. Who does that anymore? But it's very helpful. And that's going to be your emotional, your psychological, and your social well-being. And it's not just the presence or absence of a mental illness. And a lot of times that's what people think. Like if you have good mental health, that means you don't have a mental illness. And if you have bad mental health, that means you have the presence of a mental illness. And that's just not how it is. And it's lifelong. It develops from childhood to adulthood. And much like our physical health, this is going to change all throughout our lifespan. And there's going to be many things that's going to factor into how that changes. There's going to be our genetics and our environmental factors. Okay, thank you. Bear with me. I know there's a lot of words on there. So a couple of aspects of mental health that I wanted to review. First is emotional well-being, and that's the ability to manage emotions like happiness, sadness, anger, and fear, and doing all of that in a healthy way. So again, I mentioned that I was a sports lover, so I gave a bit of an example regarding sports. So John and Jerry, they're coworkers, they're in a conference room, and they're talking about this past year's Super Bowl. We have John, who is an avid Eagles fan, which is the right choice, go Birds. We also have Jerry, who is cheering for the Kansas City Chiefs. Now, John was riling him up. He was teasing him. He was saying things, getting his goat. And even though he knew and could see that Jerry was getting upset, he didn't stop. Then we have Jerry, who got so upset that right before this big conference call, he takes a conference telephone and he smashes it. So right there, we do not have two individuals who have good emotional well-being skills. John, he's not handling his happiness well. Jerry, definitely not handling his anger very well. Then we have psychological resilience, or that's when you cope with your normal stresses of life, you're recovering from any setbacks, and you're adapting to change. So naturally, smashing a conference phone, not really okay in the work setting. Jerry gets fired. And after getting fired, he finds that he's able to visit the beach, which he hasn't done in a long time. He finds a new career. He loves his new career, and he reports that he has never been happier. So in this example, even though Jerry does not have great emotional well-being, he is able to adapt to this setback, this career change, and the stress of losing his job. So Jerry's doing great in this example. And then in the last example, we have social functioning. And that's maintaining relationships, communicating effectively, and interacting with others in a positive way. So John, I mean, it's pretty crazy when your colleague smashes a conference phone right in front of you, so of course he's going to be telling all of his friends about this. And when he does so, he's like, yeah, this is crazy, right, guys? Asks for that feedback, and his friends are like, well, you're our friend, you're a good guy, but there's a lot of times when you take things too far. You take things too far. So he takes this feedback, he takes that instance, and he works on those communication techniques, and he makes those positive changes in his communication and in those social relationships, and he reports that they've never been better. So despite both of them not exactly starting out well, I did give them a happy ending. And again, go birds. So here we have the most common mental health conditions. And this is both nationally and in Pennsylvania. So Pennsylvania follows very closely with our national trends. And here I gave some statistics of the prevalence of these mental health statistics in Pennsylvania. So about 20% of Pennsylvania residents are experiencing anxiety, and about 20% are experiencing depression. Then we also have 10% of our residents who are experiencing frequent mental distress. And what that was defined as was individuals who are reporting 14 or more mentally unhealthy days over the span of a month. So more than half of their days are not well over the month, and that's 10% of us. And here, I like to show this graphic. I think this graphic is incredibly important. Who's ever heard of the term on the spectrum? Okay. And most oftenly, what have you heard that term connected with? Autism, right. So autism is a neurodevelopment disorder, and just to be clear, it is not a mental health disorder. It is just a neurodevelopment disorder, but it's on a spectrum. So people either have it kind of mild, severely, and it's on that continuum. So sometimes people will refer to mental health as being on the spectrum or on the continuum. So I just wanted to explain both terms. And it shuts down that thinking that there's either the presence or the absence of a mental illness. And this also allows for that fluidity of mental health changes, because again, we change a whole lot throughout our lifetime, and our mental health is going to do the same. This reduces stigma, so we're not simply people who have a mental health condition or we're absent of a mental health condition, but maybe we are people who, one minute we're here, and we are experiencing a lot of changes, a lot of negative changes. Maybe we didn't have a lot of positive influences in our lives to teach us how to deal with some of those changes, and now we're kind of here. And that's okay. That's okay, because there are formal supports for that, and we will get there. It also encourages early intervention. How many people do I have here who are in med school right now, or who are in a med program? nursing, anything? Okay, great. So you don't want to start talking to somebody after they already have diabetes and they're ready to maybe having a leg amputated. You want to start talking to them when you see that alarming blood work. Mental health terminology. So we're going to go through a lot of this, and I'm going to try to make it as brief and less boring as possible. But the mental health concern, of course, those are your symptoms. Those are the issues that maybe you're feeling. Those are the things that you are going to be taking to your healthcare provider and talking about and saying, hey, these are the things that are worrying me. The mental health screening tool. I provided a sample of this right here on the side. This is the PHQ-9, and this is a screening tool that is often used by PCPs. So say you are going to your PCP and you are just going for a quick checkup. A lot of times they will include this in their pre-checkup kind of worksheets. You'll check in whether or not your insurance has changed, whether your address has changed, maybe your contacts, and then sometimes they're going to include this. And this is just a standardized questionnaire. It's a checklist, and it's just to identify signs or symptoms of mental health disorders. It's not used to diagnose, but it's kind of used as a flagger, like, hey, this person scored pretty high on this. Maybe I should talk to them about potentially connecting with somebody else about some resources. And then there's the diagnosis, which comes after the formal assessment, comes after some of the formal conversations that you have with a therapist or another licensed individual. Here we have levels of treatment for mental health, and there's lots. And I put them in least restrictive to most restrictive. So from outpatient, that's about 1 time per week. It is for mild to moderate symptoms. You can function daily in life, but maybe you just need some formal support to help you get through some things or manage some symptoms. IOP is highly structured. You are going for a few hours each day. There's lots of group support, and there's not 24/7 supervision, but there is a lot of focus on building some of those basic coping skills. So a lot of the individuals who are referred here do not have those basic coping skills, and they constantly revert to crisis mode. And when you're in crisis mode, that is oftentimes when you end up here, and we try to avoid that. The PHP program, those are day treatment programs where you spend all day programming, whether it's medication, treatment management, group support, you're doing individual sessions, but they can return home at night. So they're not in crisis, they're not at risk for harm to themselves or others, but they do need this intensive ability to work with others to build their own coping skills and their own psychological well-being. The inpatient hospitalization, this is short-term. This is not supposed to be a long-term solution. This is 24/7 care in a hospital for individuals in crisis. And it's specifically for those who are at immediate risk of harm to self or others. And we just want to get these individuals stabilized and safe. So if they are not reporting symptoms of being at risk of harm to themselves or others, they're likely going to be diagnosed and then referred to one of these levels afterwards. And residential treatment is for individuals who need that 24/7 care. It's not that they are at risk for harm to themselves or for others, but they can't live in the community either because they need that support. And in this residential treatment setting, they are going to be learning life skills, community living, and also focusing on therapy and bettering their own selves. Again, a lot of terminology here, a lot of words, so bear with me. So I'm just going to give everyone a minute with this, just to look it over. Does anyone have any questions so far? Or does anyone have any comments? Questions, comments about any of the terms on here? It's likely many of you have seen these words before, but maybe didn't know exactly what they meant. So the treatment plan, that's the collaborative plan between you and your therapist. That's what you're working on. Those are your goals. The support group, I think an example of that, the most famous one would probably be AA. I think many people have heard of that. Your coping skills are things that you're using to manage stress or challenging situations. One of my coping skills, I think I already shared, I love reading. So that's something I'm going to do when I'm feeling particularly stressed. The risk factor is anything that increases the likelihood of developing a mental health problem. So something of that could be, trauma in childhood, maybe growing up with a parent who has significant mental health impairment or who has a substance use disorder. Protective factors, and those are the ones that are going to protect you from developing a severe mental health problem or helping you to cope more effectively. Self-care. How many people have heard self-care? Especially my med students. Yes. That is definitely a popular term. I know that we are definitely becoming much more aware of this and how we don't do enough of it. We don't take that time to really take care of ourselves, to recharge, to reduce stress, and to go back on, through our days. And then I'm going to skip forward for the sake of time. Here are some modalities that therapists use when treating patients. And yes, there are a ton of acronyms: CBT, DBT, EMDR, ACT. And cognitive behavioral therapy. Well, first I want to call your attention to, I'm sorry, let me back up a moment. Everything starts with evidence-based, right? So we are not just pulling this stuff out of thin air and trying it on you and hoping that it works. This is something that is tried and true and has some validity. So cognitive behavioral therapy is really helpful in terms of anxiety and depression. It helps to identify negative thought patterns, and then therefore it can help to change those thought patterns and behaviors that come along with those negative thought patterns and lead to specific behaviors that you do want to change. Dialectical behavior therapy, or DBT. In my undergrad, I did accidentally call it diabolical behavior therapy one time. I will not make that mistake again. That is a specific form of CBT, and that is really all about emotional regulation and helping people to understand their own boundaries and help to form better interpersonal relationships. And then we have EMDR, which is wonderful for trauma, and it helps people to process, reprocess, and heal from trauma without necessarily digging everything up from the past and having everybody talk about it and go through every single detail, which can sometimes be more traumatizing. But you need a very specific type of training in order to perform this type of therapy. And then we have ACT, which basically allows you to live more comfortably with your own thoughts and engage in behaviors that aligns with your values. So here we have the who of mental health. First, we have our psychiatrists, and they are a doctor or someone who went to med school. They are the unicorns of mental health, and I call them that because they are individuals who are the highest or most trained individuals who can manage your medication, and they can also diagnose, and they're really going to take a biological look at mental health and understand it from that perspective. Does anyone here or anyone know of anyone who has tried to get an appointment with a psychiatrist? Was anyone told that their appointment would be more than 8 weeks?
Yes.
Yes, and that is part of the reason. We have a lot of demand in the area, Again, 20% for anxiety, 20% for depression, and that's not even including all of those other psychological disorders that are common in this area, and trying to get an appointment to see that individual can take a long time, and that's certainly a barrier to care. Then we have our psychologist, who is a PhD or a PsyD, and they are definitely important in therapy, assessments, and research. They can diagnose. They certainly see individuals privately for sessions. We have our social workers, our counselors, our marriage and family therapists, and they're all master's level, but they also kind of have a slightly different focus. As you can see, the licensed professional counselor, they're just doing therapy. Social workers, they are doing therapy, but sometimes they do case management and advocacy. Maybe think about your medical social workers. I think that's the best way to kind of differentiate between those two. And then, of course, your marriage and family therapists are focusing on relationships and families. And then we have our nurse practitioners. They can also prescribe medications, which can be helpful. And they are working to diagnose. It is less common to have therapy sessions or to meet with these individuals week after week. Normally, you will meet with them on a several-week basis once they prescribe you medication. We also have case managers or case workers. We kind of use that term interchangeably. And these are wonderful people who will complete assessments to identify your biopsychosocial needs. And they create that short-term treatment plan. So maybe you are somebody who needs to be connected with housing or transportation. Maybe you have some food insecurity, or you're looking for mental health treatment and you're not sure where to go, but hey, you are connected with an agency that has a caseworker or a case manager. They're gonna get you connected. But this is not somebody that you can just look up online and say, hey, I think I just want a case manager, and work with them. They are somebody that's part of a larger system, like a hospital, treatment centers, social service agencies, or insurance companies. And the peer supporter is kind of the same way in that they are part of that larger system. They work in an interdisciplinary team. They are someone with lived experience who shares that lived experience to connect with somebody who is seeking services to help motivate them or to share what they did to overcome their own personal recovery barriers. Knowing when to seek help. I'm going to show this guy again because he's very important. The continuum or the spectrum of mental health. So again, most of us are going to struggle within our lifetime with mental health. And roughly 20% of Pennsylvanians have an anxiety diagnosis. And again, 20% of Pennsylvanians have a depression diagnosis. In 2022, I don't have more recent data than that. This was published by the CDC. You'll see some of my references at the end. Hopefully next year we'll have some more recent data. But there was about 2,000 deaths by suicide. 80% of those were male, despite 50% of the population being male. Why? Any guesses? Yes.
Stigma.
Stigma, thank you. Yes, stigma. And that is the great way to hop into the stigma slides. But unfortunately, due to our social and cultural stigma, men are taught that it's okay to feel two things, happy and angry, and everything else you're not supposed to portray or feel, so that kind of gets stuffed under the rug and it leads to more and more issues. Stigma. Maybe you recognize these characters, maybe you don't. There's definitely a lot types of stigma, but for the purpose of this presentation, I'm going to focus on two. However, think of it like the upside down triangle. We are having the stigma at the very top in our history, in our culture, in our policies, and then it's seeping down into our society, into our interpersonal relationships, and down into the individual. So this is the negative attitudes, beliefs, stereotypes that people may hold towards those who experience mental health conditions. So the normalization of calling others crazy, the normalization of looking at these people like, yeah, they're insane. And now I'm not saying that if you have ever watched these movies that you can justify their behaviors, because you really can't, but calling them crazy without considering any other factors that have gone into making them who they were is also a part of stigma. How about avoiding people with mental illness? Say you're walking to a nearby coffee shop and you see a gentleman sitting on a bench and he's talking to himself, and it's very clear he is talking to himself. Are you staying on that same side of the sidewalk? Are you engaging in conversation with him? Or are you moving to the other side? Especially if it's at night or early in the morning and no one else is with you. And how about assuming people with mental illnesses are violent? How about that one? And that really ties into the last bullet point of the media wrongly portraying mental illnesses, especially schizophrenia. They definitely tend to tie that diagnosis specifically as being intertwined or directly correlated with violence. And again, without considering any other cultural factors or environmental factors, that is dangerous, and it continues to perpetuate this cycle of stigma. So stigma as a barrier to mental health care. And the next type of stigma that I wanted to focus on was at the bottom of the triangle, or self-stigma. And that's when we internalize beliefs about ourselves. We feel shame or guilt for needing medication, therapy. We believe that our own mental health struggle is a weakness or some type of failing. And this definitely prevents people from seeking help or discourages people who need services from continuing services. Like, I'm not that bad and there's someone else who needs it more. Or I met someone down the street who is near homelessness, or who I can tell has much more environmental things going on, and I don't want to take up an appointment because they need it more than I do. That is self-stigma. So this leads to a very particular group of individuals, a very specialized population, and that is our healthcare providers. So there was a survey that was done in 2024, so very recently, and that is of our healthcare providers. And they reported on this survey that they felt symptoms of depression, anxiety, and burnout. And yet 40% of them said, even though I felt this, I didn't seek treatment. Why? Well, there's the fear of the professional consequences. Perhaps someone will find out they're in therapy and it'll have some bearing on their medical license. Now, this is not rooted in fact. This is these beliefs that are sometimes thought, but for no reason other than fear and stigma. Negative judgment from peers and supervisors, being perceived as being weak, and the discouragement of being vulnerable. So it's no secret that med school is tough. That is very tough. And that you're going to go through many tough situations, and a lot of the times it's like, okay, well, there's not really a lot of time to sit on that. You need to work through it and move on to the next thing, because a lot of people need you. And then there's the personal consequences of not seeking help. Of course, the ultimate one being suicide. And depression rates are significantly higher among these professionals than in the general population. And then there's professional consequences of not seeking help, which is medical errors, lack of empathy towards patients, burnout, and early career exit, which, if we kind of consider what I talked about in the earlier slide of psychiatrists being the unicorns of mental health, we can't afford early exit. So we really want everybody who needs to get the help that they need. So when should you seek help? So again, this nice little picture that I included. I hope you guys are really getting the point that I want you to remember, that this is on a spectrum. If you are feeling persistent emotional distress, so not that you woke up and you're having a bad day. Everybody's going to go through that. We're humans. We all have bad days, every single one of us. But that you're feeling overwhelmed, anxious, depressed, maybe more days than what you're feeling happy. the emotions are intense and long lasting. Maybe even if something in your life is going well, maybe you had a promotion at work, you got a really good grade on a test, or things in your personal life with your family, you're celebrating things there, but still nothing's really lifting your mood, it's probably time to seek some help. How about difficulty functioning? Completing any of your daily tasks, decline in your work or school performance, isolating yourself from seeing your friends or from any relationships that you may be in, changes in your behavior or physical health. So if there's changes in your sleep, your appetite, your energy levels, if you start using maladaptive coping skills like substances or alcohol to cope, engaging in risky or self-destructive behaviors, it's usually this one. That's when people start to notice, and maybe a little bit here with the withdrawal and the decline. So when people can actually physically see those behaviors, that's when others may say, hey, is everything going okay with you? We've noticed that you're not hanging out with us as much, or we noticed that you're not eating when we all have lunch together. What's going on there? There could also be some thoughts of self-harm or suicide. This is, of course, a huge red flag, and that is something that's going to, I hope, urge anyone in this room, if anyone discloses that they are having those thoughts, to support that individual in either going to their local emergency department or calling crisis. And you've tried coping on your own without relief. So for example, I've disclosed that I love reading. So maybe I'm going through a stressful situation, some personal things. I've been feeling a little bit more sad lately, haven't been sleeping as much, struggling there. And I'm still talking with friends, hanging out with them. I'm still reading like I normally would. Maybe some of these behaviors haven't changed drastically, but I'm still doing everything that I like, and things are stuck or getting worse. Then it's definitely time to call in some formal support as well. So how do I access mental health services? So because I work for an insurance company, but this is true for most insurance companies, you can call the number on the back of your insurance card. So most likely there's a 1-800 number on the back of your insurance card. You can connect with them, and it will be a live person, hopefully not a robot, and they will tell you some providers and resources in the area that you can reach out to set up services. And that's wonderful because they're only going to tell you services that are covered by your insurance. Next, we have psychology. Is it okay if I go back there to do the demonstration? And okay, sorry. Another really great resource is Psychology Today. Okay, yeah. Sorry, I don't mean to be the person to make things complicated. All right, there we go. So this is what Psychology Today looks like. And let's just say you are looking for a therapist. I'm just going to type in my zip code. and I'm just going to click on the very first person. So Thomas, you can go ahead and read through his profile. Over here is where you're going to see what he specializes in, and you're going to see what he accepts for his self-pay rate, which is without insurance, and plus he says, hey, I accept insurance. And down here is the insurances that he does accept. So this does take a little bit of reading, but I also find that you can find a lot of personalized services here. So say that you're looking for someone specifically who is very well versed or practiced in EMDR. Going here, clicking in the zip code, and then going to filters, you can really nail down exactly what you want in a therapist, which can be very helpful. Yes?
Does it show you ratings?
Some of them do. I don't know if he has ratings here, but also if you Google him, he is likely on other websites promoting himself because this is a business. So you could also see ratings there. Okay. And then secondly, we have this was just a quick Google search of mental health services in Scranton, Pennsylvania. And here we have lots of local people who are here, who are offering services. So if you want someone who is nearby, maybe who offers in-person services, I'm not saying that there's anyone on Psychology Today who does not offer in-person services, but a lot of times they are virtual. So I just wanted to show you all how to do that, how to access that. But anybody who is in Pennsylvania and who accepts your insurance, okay, thanks. You will be able to see them. I understand that sometimes we don't want to go to community places, particularly if you work in the area and you refer clients there all day long. Sometimes you don't want to go to the same place, and that's understandable. You can go. Oh, sorry. All right, so common mental health setbacks. I scheduled an appointment, but it's 3 months from now. And that was the situation that we touched upon earlier with scheduling a psychiatrist appointment. There are other services out there that you can try, particularly for medication management. However, PCPs are definitely seeing a lot of increase in dealing with mental health issues, and they can absolutely prescribe medications, particularly when it comes to disorders like depression and anxiety. So if you have this appointment and you want to see a psychiatrist, that's fine, but if you need something more immediate, that can be a great option in the meantime. I called for an appointment and I left a message, but nobody has returned my call. Say you use the Psychology Today function that we just reviewed, and there was somebody that, you added all these filters of somebody that you believed would be a perfect fit for you, but they haven't returned your call. Why? Why is that? It could be that, one, they haven't gotten around to it because usually the people on those websites are their own administrator, their own scheduler, their own biller. So they are doing everything, and sometimes the way that they do intakes are a little bit slower. Also, it could be that they are not taking in new clients. Most of the time, they are good at updating that, and it'll say right under their profile, not accepting new clients at this time. But also in the field of mental health, 1 week you may have 20 referrals, everybody wants services, you get everybody in, but then maybe 5 people don't fill out their intake paperwork, 5 people show up for the first session, another 5 don't show up for the second session, so then they're weaning out, and then you can finally get to those people, but that's going to take 3-4 weeks. The therapist I'd like to see does not accept my insurance. So this can be avoided, again, by calling your insurance company. That's usually the best way to figure out who does accept your insurance. However, there are self-pay rates that if you call the insurance or the community service directly, they will disclose that with you and can sometimes work something out. And the therapist I'd like to see is not accepting new clients right now. So much like what I talked about before, the ebb and flow of clients waiting for mental health services is often changing. So sometimes you can be put on their wait list, or you can ask them, hey, I found you, I felt like you and I would be a good match. Who would you recommend? And more often than not, they have somebody in mind that they would be more than willing to share. So you've started therapy now. So what would make you a good client? What should you do and what shouldn't you do? So some therapy do's. Share your reactions and your responses. If you're in therapy and your therapist says something that's way out of left field and something that maybe you are not sure how it fits with your treatment plan, you're not sure how it fits in with what you were just saying, ask, tell them, let them know, hey, I'm confused. What does this mean? Ask questions, particularly in regards to your treatment plan. Your therapist should 100% be able to answer, hey, this is what we're doing. These are the interventions that we're doing. This is the theory that I'm basing my modality or my interventions off of. And they should be able to give you any type of psychoeducation behind that. Check in on your own progress. I'm sure that you will be aware of your own progress, and hopefully your therapist does talk about this with you, but it's okay to ask. It's okay to ask for your therapist's observations. Do your homework or reflections. Oftentimes therapists will ask you to complete assignments, whether that's just thinking about something, writing out lists. Sometimes there's worksheets. And as much as therapy is helpful, it is usually 55 minutes to an hour a week. And there's only so much that can be done one time per week for 55 minutes to an hour. It's really helpful to make sure that you are doing whatever it is that you talk about in therapy, that you're putting that into practice. That way, you can come back to session and say whether it's helping you or not. Because if it's helping you, great, you can continue to strengthen that. But if it's not, well, then you and your therapist need to change directions on what you're doing in order for it to be most effective for you. Celebrate your small wins. It's a journey. And I think that everybody kind of compares therapy and mental health wellness, and a lot of times even physical health wellness, to a journey. So celebrate those small wins. Be patient and compassionate with yourself, particularly if you are someone who has talked yourself out of therapy a million times, or how I like to word it. And I've done it myself. I've bullied myself out of therapy. I have a master's degree in social work. I don't need therapy. Well, I was wrong. And I'll leave that there. Therapy don'ts. Don't withhold information or lie. Therapists can't help you if they don't know the whole story. They need to be able to understand fully what's going on. Don't inconsistently attend sessions. It's kind of like if you're training for a marathon and you run, I don't know, maybe you're running twice a week at first, and then you take a break, and then you're running, then you decide to go for a 5-minute run one day, and then you decide to go for a 20-minute run 4 days from then, and it's all inconsistent and there's no schedule. You're not going to get results to be able to perform well in a marathon. And the same thing goes for therapy. Don't believe that progress is linear. So once you start therapy, it's not going to be from here to there. As much as I wish that was the case, it's not, but it doesn't mean that you are not reaching milestones and that you are not making progress. It just means that we are humans, we have setbacks, we have triggers, we have all of those other terminology things come into play that we talked about a little bit earlier. And that one day things could be going well, you could be using the tools that you learned in therapy, and the next day is terrible. It's terrible, maybe you lash out, maybe you don't feel like using any of your coping skills and instead you have a large glass of wine. Again, it does not mean that you are bad, not good, or not making progress. It just simply means that you're human. And the fact that you were able to at least put some of those coping skills into play beforehand, that says something. Don't expect quick results or fixes. Particularly if you have some deep-rooted traumas and things that have been going on for years and years and years. So for example, I'm 35, and for 35 years of my life, I have learned something one way and one way only. And then all of a sudden I'm going in and saying, hey, I'd like to change 35 years of behavior. That's not going to be fixed in 2 to 3 weeks. That's going to take some time and consistency. Don't avoid the difficult emotions. We like to do that. And it's particularly easy now with smartphones. Distraction is definitely one of those things that we use to get ourselves away from feeling sad. And that's okay to get ourselves away from feeling this low of sad to just being able to deal with those emotions of sadness. But you don't want to avoid it entirely. And don't expect your therapist to carry on the conversation. This is your session. You're paying for it. What do you want from this? This is your journey. And how to know if you have the right therapist. So just as you should know how to be a good client, you should know when a therapist is being a good therapist. You can talk to them. You can tell them things. You don't feel that they are being judgmental. You feel that they are being empathetic. They are there with you. They are present. They are repeating things that you're saying or expressing active listening skills. They are accurately assessing and diagnosing conditions. They can communicate with you clearly and effectively. So again, asking questions, they should be able to tell you everything here. They work with you in a collaborative way. A therapist is not an advice giver. A therapist is someone who is going to work with you. You are the expert. You are the expert in your emotions. You are the expert in your own experiences. And the therapist is simply there to help guide you through and teach you new ways to deal with things, but not give you advice. They maintain professional boundaries. Now, this can be a bit of a tough one because, of course, they need to be likable. You need to be able to tell them things, but they're not your friend. So while you may chat about things that are outside of the scope of therapy, they still have to maintain that line of, okay, yes, we can chat about things that are non-therapeutic, but maybe for 5 minutes. And then it's down to business, and we need to make sure that we're working on your treatment goals. They understand their own limits. It may be that you meet with a therapist, and after 2 or 3 sessions, they say, I'm really sorry. You're a wonderful person, but I need to break up with you. And they refer you out. They refer you to someone else. And this may be for several reasons. One may be that your story is very similar to something that triggers them, and that's going to cause bias. And that bias may be positive or negative. So they need to do what's right for you and send you to someone who doesn't have that bias. Or it may be your mental health condition is something they're not experienced with, and that's okay. Just like you would refer someone else out to another specialty if that wasn't your thing, or like, hey, you know what, I don't know, but you could go ask Bob down the street for anyone else. You understand your own limit, and it's not personal. It is for your best interest. They ask for feedback on your progress. So just like you can ask them for their observations of your progress, they're going to ask you, hey, how do you feel our sessions have been going? Do you feel what we've been doing is working? Let's review our treatment plan again and make sure that we're on the right path to reaching the goals that you want. Let's review those goals again. Do we need to change those? Do we need to do anything else? And then they're going to reinforce those positive changes. So just like you celebrate those small wins, they're going to be right there with you. Resources and questions, comments.
Okay,
Sure. I'm interested to know what is your feedback on folks who have reached out to the platforms that are, thank you. This is nice. Who have reached out online. Like, what are your thoughts about platforms like BetterHelp or the apps that you can now download or have access to that really give you a breadth of resources, but offer you like ultimate privacy? Because you could pop open the app and you can be, at home and totally away from anybody, like within your social circle, your colleagues, your peers, or whatever. So what is your feedback on that?
I feel that anybody who's reaching out for formal support and they feel that that is best for them, that they should absolutely pursue that. And I think that you can usually know after about 3 sessions on whether or not that is for you, whether or not you connect with your therapist, and whether or not you're getting something out of it. I'm not saying that you're going to reach this huge epiphany where all of a sudden a magical change is going to occur, but you should feel, okay, yeah, I think this might be for me or it isn't. I haven't personally tried it myself, but I know that it is definitely very popular. And I know with the wait times that often happen, at least locally, that people are turning to those apps. So it can be a really great resource.
Okay, I kind of like align with what you're saying. And I have another question. Can I keep the dice? Okay. My other question was in reference to when you find, the appropriate mental health professional, the person's in a session or what have you. What are your thoughts on when somebody's there, because they know they need the help, they find the right therapist, they're in session, and maybe their version of what they're trying to explain or disclose is really quite skewed or doesn't really truly reflect a lot of what maybe the reality behind the story is. I mean, I'm not saying anything that is finding anybody to be like scratching your head, because a lot of people, just in our normal ways of life, we don't ever want to appear negative or highlight our deficits. We want to appear like, yeah, I need help. I'm okay, but I have a couple things that aren't okay with me. And then they paint a picture to the said therapist that really doesn't reflect the accuracy of maybe like what the dilemma was that brought them to therapy in the first place. So how do you deal with that?
I think it depends on your level of rapport. If this is a client that you're meeting for the first time, I don't think being too confrontational with them and calling them out on the discrepancies in stories is going to keep them around for very long. But I think that once you give them a chance and keep asking questions and keep encouraging them and supporting them and appearing empathetic and non-judgmental, they may come around. And then and even if they don't, once you build that rapport, you can start being a little more confrontational and direct.
Okay, very good. Thank you.
You're very welcome.
Thank you.
Any other questions in the room right now?
So what's the status of artificial intelligence in this area, and where do you see that going?
Oh, I don't even think it's just in this area. I think that's definitely a national kind of platform right now. And how much do you trust AI? You can go on AI right now and ask them for any type of mental health help. You could ask them, where do I turn for mental health help? And it'll even disclose at the bottom, may not be accurate. So I think it's very helpful. I think it's a great tool. But for right now, considering that it's still in development, I think we should continue to rely on actual people, or at least in conjunction.
Any other questions in the room?
Thank you for your presentation. You may bring this up, but in terms of resources, some companies or organizations, at least at Geisinger, I know we offer EAPs, employee assistance programs. So that's another place that people can reach out to, right, for quick help in terms of mental health. Is that right?
Yes, that is correct. A lot of, and especially on like the Psychology Today website, a lot of them will say which EAPs they accept. But if you are also an employee at Geisinger, you can visit the Employee Resource Center, and they can get you quickly and confidentially hooked up with care as well. And with places that do accept our insurance.
Great, thank you. We'll do a couple questions from the chat and then a few of the questions submitted in advance.
Okay.
One from the chat is, how do we know if our triggers are something we have to work on getting rid of or managing on our own versus something we can ask others or the environment to not activate?
Sometimes it's good to get feedback from others on what your triggers may be, particularly if you are unaware. However, if you are particularly reactive to something, or if, I'm sorry, could you read the question again, just to make sure I'm answering
Absolutely.
all components?
Sure. How do we know if our triggers are something we have to work on getting rid of or managing on our own versus something we can ask others or the environment to not activate?
Okay. Are they interrupting your life? Are they disrupting your daily routine? Is it a trigger that is, say you're at work and you have to go cry in a separate room for 20 minutes? I'm not saying that that cannot be managed, but is that something that you want to continue to manage that way? Can you talk to friends about that and ask for other coping skills? Or is it time to reach out for help? I know sometimes there is a lot of gray area on when is it time to reach out for help. But it does sound like if there is something that is disrupting your daily routine, that it is time.
Thank you. Next one from the chat. Robert L. Spitzer and the good folks that developed the PHQ were funded by Pfizer. Although widely used, do you have any concerns with the PHQ with oversensitivity, potentially resulting in false positive diagnoses and overtreatment?
No. I would rather have more people who come up as positive and be referred to our services than not catching enough people and having somebody who is depressed and going under the radar. People at the end of the day, even if they are referred to a service, say they are coming up as positive or testing as being positive for moderate to severe depression, and they're being referred to a behavioral health professional, does not mean they need to continue with services. Autonomy is very much so the very first thing. So even if somebody is depressed and they don't want to continue with services, we're not going to hold you down and force you. And same with individuals who are like, oh, well, I think I was just having a bad day when I answered that questionnaire. Really, I mean, I'm okay. I have these supports. I do this, this, and this in the community, and I'm okay. And I feel like I don't need that at this time.
Thank you. And then 4 questions that were submitted in advance. What is the best way to get a new patient plugged into coordinated wraparound care for multimodal treatment, diagnosis therapy, group medication, management of mental health disorders?
The best way from a treatment perspective is motivational interviewing, letting them come up with the idea. Hey, what has helped you in the past? What do you think would be helpful right now? And continuing to ask those meaningful questions to really get down to what it is that they want. And if they are repeating, well, I want to feel better. Oh, you want to feel better? What does feeling better look like to you? And how do you think we can get there? So you're saying that feeling better means that you are sleeping more at nighttime. You're sleeping at least 7 hours at night. Perhaps you are not binge eating in the evening time, and you're able to focus when you are at work. What do you think would help with that? And a lot of times when individuals come up with the idea on their own, they are much more likely to be engaged with it.
Thank you.
And it may take several times. It may not be the first time you have this conversation.
When living with an individual who has a chronic mental health condition, what are the best ways to support them in day-to-day life?
Depending on the condition, but I think how you can support them is really just attempting to be non-judgmental, the same way that a therapist would. Again, talking to them, asking what they think would be most helpful, offering them any resources in the community, and to a certain point, stepping back. Because you can't also be your loved one's therapist or your loved one's only source of support.
We have two more questions, but as you just said that, I have a question. How do you respond to a family member who says to you, you don't need to see a therapist, you have your family to talk to? Asking for a friend.
I can tell that's I think every family-based therapist right now would be up in arms and ready to answer this for you. But what I can tell you is that I think it would be best to talk to the individual alone. And really talking to them and rephrasing that question to them. Okay, so what do you get from your family member? Like, what is the helpful support you receive from your family member? What type of support are you missing? But trying to, of course, word it in very positive ways as to not attack the family member and make it seem that they're not doing enough, because then they might leave very quickly. But I think in that instance, it would definitely be best to talk to the other family member alone.
And I'm okay being slightly more specific about it. So I have seen a therapist since my grandmother was sick in 2012. And just recently was asked by my mother, why do you can talk to us. And I also think she could have benefited from talking to someone when my dad passed away. But I think it's a generational thing that, she's not going to seek that. Even a sister that's 10 years older than me, same, doesn't want to go that route.
Sure. Stigma.
Yeah.
It's the stigma still from that generation. I think we're doing better. I think we're opening up these discussions. I think that we are doing a much better job of normalizing having these conversations. But at the end of the day, there's still going to be some of that exists. And you can say, Mom, I love you and I love talking to you about things. But sometimes I just want a stranger to hear my problems.
Thank you. I was glad I got to insert that one in. Okay, back to the advanced questions. When access to resources is limited and may take time, what do you recommend for families who may not be in suicidal crisis, but are experiencing significant life disruption?
Okay, yeah, and that has definitely happened, particularly over the COVID pandemic. We had seen a huge rise and increase of mental health symptoms, and it goes back to that, to developing those coping skills and meditation and mindfulness. I don't want to say meditation specifically, but mindfulness is a huge one. And this one I can actually defer to Dr. Google on. You can look that up. Look for ideas on coping skills. Maybe you don't have it off the top of your head because you're like, okay, I do these things, but I don't even know if they're a coping skill. Google it, look it up. There are some reputable sources out there, particularly those from universities. So if it says .edu, I would trust that more so than just a normal source, or therapist aid, or positive psychology. Those can be other really good ones.
Thank you. And the final advanced question, do you have any thoughts about the federal proposal to eliminate the National Institute of Mental Health and consolidate it with a National Institute of Behavioral Health? Will that be helpful?
I have so many thoughts on that. Not enough time in regards to this presentation, but if you want to invite me back, I would gladly talk for another 2 hours on it. I'm all for efficiency, I will say that. I think in some ways it could be more efficient, but I think any type of cuts right now to our mental health programs and our substance use disorder programs is very harmful. We are just starting to see the effects of what these programs can do for our individuals in the community, and I would hate to see any of that go away.
Thank you.
You're welcome.
That's all for the advanced questions and the chat questions. Anything else from the room? Okay. Thank you, Brittany, for being here. We appreciate it. And perhaps at some point we'll have you back to expand on that question.
Yes, yes. But this time I'm not taking 80 or 81. If that is at